Welcome to our presentation. We chose internal family systems for this project.
IFS founder Dr. Richard Schwartz describes IFS as finding harmony in your inner orchestra. The self is the conductor, your parts are the musicians, and with teamwork, they create a beautiful symphony. IFS therapy emerged in the mid-1980s. Schwartz observed that his clients described their emotions in terms of different parts wanting or feeling uniquely. His curiosity and exploration led to the realization that our inner parts operate similar to members of a family system. Schwartz was inspired by family systems therapy, which focuses on dynamics between family members, and applied the same approach inwardly. Today, IFS is widely used in psychotherapy, coaching, and personal development. So who is the IFS founder, Dr. Richard Schwartz? He earned a PhD in marriage and family therapy from Purdue University. He is a former associate professor at the University of Illinois and Northwestern University. He established the Center for Self-Leadership in 2000 to provide training, conferences, and resources for IFS. And he's published many books, including No Bad Parts, You Are the One, The Mosaic Mind, and over 50 articles about IFS in the literature. Schwartz began his career believing the mind was a single unified entity, focusing on external relationships rather than internal mental processes. While conducting a study on bulimic clients, he found that changing external dynamics didn't resolve deeper issues. Rather, clients continued harmful behaviors despite apparent progress. When asked why clients spoke of inner parts within themselves that acted autonomously, initially concerned this indicated multiple personality disorder, Schwartz explored his own mind and discovered they too had distinct inner parts. This revelation sparked curiosity and led them to further investigate these internal dynamics with clients. So the background on IFS that formed the basis is really based on family systems therapy, which he was traditionally trained in. This therapeutic approach views the family as an emotional unit, focusing on the interactions and relationships among family members to address issues affecting the family as a whole. The important premise of family systems therapy is that what happens to one member of a family happens to everyone in the family system. During therapy, the family works individually and together to resolve a problem that directly affects one or more family members. Each family member expresses their thoughts and feelings about how they are affected. Family members explore their individual roles within the family system, learn how to switch roles if necessary, and learn ways to support each other. So these are the basics of the orientation within the lens or through the lens of the way of being in the WAYS paradigm. And this is a quote from one of Schwartz's books. Clients depicted how these parts interacted with each other and had relationships. Some fought, some formed alliances, and some protected others. Over time, it dawned on me that I was learning about a kind of inner system, not unlike the external families I was working with, hence the name internal family systems. Way of understanding. The key points here are multiple sub-personalities or parts which have a dialogue. And then through understanding, Schwartz separates the parts to allow space So parts are dormant or manifest, traumas or attachment injuries. Parts get stuck in these roles trying to protect their system. Many are frozen in time in different trauma scenes, often from childhood. Parts are disconnected from and polarized from each other. This differs from widely accepted mono-mind belief. Wounded parts often become clients' identity rather than identifying with the self, which is a much more integrated whole self, which we'll go into. The IFS model is experiential and non-pathologizing. Parts are categorized into three main groups. Managers, which handle day-to-day life and try to protect from emotional pain. Firefighters, which respond to emotional crises and distract from distressing feelings. And exiles, often wounded parts that carry pain and trauma, typically hidden to protect from hurt. Now, the self is capitalized here because it's the centerpiece of the model. It's the undamaged essence. Self is a compassionate witness to the history, emotions, sensations the parts need to feel witnessed. There are 8 qualities of self that Schwartz has defined as courage, creativity, clarity, calm, confident, curious, connectedness, and compassion. The self witnesses wounded parts to help clients access these states and heal themselves. IFS helps you not only start to pay attention to parts, but also become the active internal leader or self that your system of parts needs. So within the ways paradigm, in Cheston's model, the ways of intervening are defined as the work of therapy, the means by which a counselor interrupts the client's cycle of dysfunction and allows for the processing of healthier alternatives of thinking, feeling, and behaving. So as that relates to IFS, the self helps to unburden fears and responsibility of traumatized and frozen parts. The self does this by listening to, embracing, and loving parts, allowing them to heal and transform. Even the most destructive parts have protective intentions. Parts are often frozen in past traumas when their extreme roles were needed. And when they trust it's safe to step out of these roles, they are highly valuable to the system and oftentimes have resources that are available. So the intervention involves shifting identity from parts and beliefs to knowing this self, which can provide leadership internally and externally. Release of these extreme beliefs and emotions allows parts to transform into naturally valuable states. Restoring parts' trust in the leadership of the self or trust in self-leadership is key to the way of intervening. Those parts, when approached from this mindful place, this respectful, open, curious place, will reveal the secret history of how they were forced into the role they're in and how they're stuck in that role, terrified that if they don't do it, something dreadful will happen, and that they're frozen in the past during the traumatic times when they had to take on the role. Maybe, like children in dysfunctional families, they are forced out of their natural, valuable states into roles that sometimes can be destructive, but are, they think, necessary to protect the person or the system they are in. And so this is Schwartz speaking. So I started trying to help my clients listen to their troublesome parts rather than fight them, and was astounded to find that their parts all had similar stories to tell of how they had to take on protective roles at some point in the person's past, often roles that they hated but felt were needed to save the client. They each had qualities and resources to bring to the client's life that were not available while they were tied up in the protective roles.
And as we move into general and clinical applications for IFS, IFS is commonly used to treat depression, anxiety, panic, phobias, trauma, substance use, and it is also used to help physical health conditions such as rheumatoid arthritis and also general functioning and well-being of a person. So it is applied to addiction and recovery. And as we move away, and with IFS, we move away from looking at addiction as a moral issue. It sees the part of the protector trying to survive by numbing overwhelming exiles. And the exiles are the wounded parts. And so the numbing the exiles results in addiction, such as alcohol and drug use, emotional eating, gambling, shopping, sex addiction, and other addictions. And so IFS helps us figure out what the firefighter is fueling the addiction by. And so the firefighter is trying to distract the person from their distressing feelings. And IFS can help to work with the system to find alternative ways to deal with the problem. And working with healing the exiles to alleviate their pain, and that pain is what is feeding into the addiction. Another application of IFS is trauma and PTSD. And as was mentioned, it works with inner conflict from a non-pathologizing approach. And it offers a safe way to heal the exiles, these wounded parts. And with IFS, you can allow the parts to process trauma at their own rate through building trust with the protectors before engaging with the exiles, because that trust building is really important. It can also incorporate practicing breath work and grounding to regulate the nervous system, and also providing a self-led anchor to stabilize strong emotions. And as Katrina mentioned, the self is the centerpiece of the IFS model. It's the undamaged essence. So that is why we want a self-led anchor. So this is applicable to a lot of different populations. These include professionals and individuals who are experiencing high stress, also children and adolescents, couples, marginalized communities, people with chronic pain or illness. So when we think about individuals with high stress, a lot of times they struggle with things like imposter syndrome and overworking. And these things can result in burnout and stress. And so working with IFS allows the counselor to work with the client's manager parts, and that starts to help to balance the work-driven parts with that self-led relaxation, bringing things back into harmony. Another aspect, if you think about conflict within the workplace, which can cause high stress, IFS can work with parts within an individual that are involved in these conflicts to start to resolve these problems. Another population that IFS is effective and used in is our children and adolescents. And this draws on their natural ability to use their imaginations and think symbolically. And so some examples of this is that a child or adolescent can externalize their parts through things like play therapy, art, and storytelling. And so the toys can represent parts, and the inner experiences of the child or adolescent can be explored through storytelling in creative ways. And this approach also offers insight to the parts of the caregivers and helps them figure out how they can help the child. Another population that IFS can help with are couples. And so you can use IFS to explore polarized parts in each partner. And so they each have polarized parts, and then that can drive conflict with each other. Another helpful thing that IFS can do is to practice leading self-led communication between two individuals, and that can help them move away from reactivity. And so this can help people in a couple recognize and develop compassion for each other's wounded exiles because they're being recognized, talked about, and worked with. So IFS can also address problems with trust and attachment. Also, like if there are repeating arguments and defensive behaviors, it can help with that. And also disconnection and avoidance can be problems within a relationship that IFS can address. Another population that IFS can work with would be marginalized communities. And a lot of marginalized communities have experienced generational trauma, cultural oppression, displacement, systemic discrimination. And so IFS can help healing within these communities through reclaiming identities and bringing in self-compassion. And also, they can work with IFS can work with legacy burdens. This is speaking to that generational trauma that's passed down generation to generation, and IFS can work with collective healing approaches in this context. So another population that IFS can assist is people with chronic pain or illness. And so IFS can work with emotional suppression and unresolved trauma that often underlie chronic pain and autoimmune conditions. And so with IFS, you can explore which parts are holding that tension, and then working with that with IFS can help to reduce the physical symptoms related to the stress in the body. And also, IFS can continue supporting healing responses that are self-led. There are some potential limitations to the clinical applications of IFS. It may not be appropriate for psychosis-related schizophrenia, mood disorders, or severe or complex trauma or dissociative disorders. And this is because splitting self into parts may be disorganizing for these individuals, and conversations between parts could be dangerous for some. And there have been concerns around false memories being facilitated by splitting of the self states. And these potential limitations highlight the need for the clinician to be thoroughly trained in trauma-informed care. So I just wanted to bring in a case study. There are a lot of these out there, but I thought this one was really interesting. It was the IFS for the treatment of depression in female college students. And so just the background for this study. So we're looking at depression, and the evidence-based treatment for depression is currently cognitive-based therapy, CBT, and interpersonal therapy, IPT, and also pharmacotherapy. So these are the go-to treatments for depression. Now, these are only about 60% effective. And even when they are effective, about 30 to 40% only 30 to 40% go into remission. And these numbers are indicating that it's time to check out some new modalities. And CBT and IPT focus on changing or eliminating unwanted thoughts, feelings, and behaviors. But Schwartz, with his IFS, proposes that this lack of acceptance of the internal parts is an obstacle to healing. And in this paper, they just talked a little bit about the IFS method and how it brings self-compassion and curiosity to the parts, the internal parts that are carrying extreme or constrained feelings or roles. They were working with the mindful separation of the parts and accessing healing qualities of self in order to participate in the inquiry with these parts. And they're also working with opening to memories, achieving a sense of peace and healing, and allowing the parts to return to their natural roles. And so once these parts return to their natural roles, they're resulting in the resolution of problematic symptoms. So in the conclusions from this study, they found that the IFS compared to treatment as usual, the depressive symptoms declined. And in this improvement, there was no significant difference between treatment as usual and IFS. And so this is really promising for IFS because CBT and IPT, which are treatment as usual, are the gold standard treatments for depression. And so this is indicating that IFS may be a promising treatment modality for depression. And there is future research that is needed, maybe considering who IFS works for the best, who that helps the most. Also just considering if the benefits are sustained over time, because that's what we're looking for in treatments. And also just looking at different developmental stages of the clients. So now as we move into multicultural considerations of IFS, like a chameleon, IFS adapts to diverse cultural values. And different cultures have different concepts of self, and cultural factors can shape how each part is perceived and understood. And these are some examples of that. In cultures that combine spirituality with emotional experiences, the self might align with concepts like Atman, mindful consciousness, or the Christ within. In collectivist cultures, parts may prioritize harmony over individual needs. And so we see this in parts of East Asia and Africa, where family and community really take precedence over individual needs. In contrast to this, we have individualistic cultures. And so in an individualistic culture, parts may prioritize personal success or independence. And so this might sound really familiar to us because in Western cultures, this is very common, and particularly in the United States. In indigenous cultures, parts may represent ancestral connections or nature spirits. In cultures impacted by colonization, war, or systemic oppression, parts may be affected by legacy burdens, which we mentioned just a little bit ago. And these are inherited traumas or beliefs. So IFS can explore how cultural values shape the role and motivation of the client's parts. A question that might be asked is, does this part feel pressure from family or cultural traditions? If discussing mental health is taboo, as it is in certain cultures, exploring the parts or trusting self can be impeded, and it can help to normalize conversations about emotions. So this can be a doorway into this kind of conversation. IFS can engage parts in culturally relevant practices. And when dealing with intergenerational trauma, it can help identify ancestral patterns and emphasize unburdening and letting the part release inherited pain. So there are benefits and challenges to using IFS. and with the multicultural considerations. Benefits include the fact that clients feel respected when therapy aligns with a cultural background, and it deepens the trust between the therapist and the client. Using culturally informed techniques resonate more, and they are seen as more effective. Integrating cultural values with emotional healing encourages self-confidence and a greater sense of identity. Some challenges that come up are potential misinterpretations if the therapist is unfamiliar with the client's culture. And so it's necessary for the therapist to maintain curiosity and continue to become educated. Another challenge is navigating cultural stigmas, and a solution to this is just respecting cultural nuances, continuing to build rapport, and adapting IFS language as it's needed. Here are the references that we used for our project. So thank you so much for being here and for your presence and participation, and stay tuned for our upcoming experiential.
Hello, everyone. In this experiential, we'll guide viewers through an inner exploration in real time. The prompts that we'll use are based on a guided experiential of IFS founder Dick Schwartz. I'll give moments of space for viewers to explore their inner response to different prompts. And after some moments of silence, we'll then have our mock client share about her inner mock exploration. The content of this mock exploration is fictional and for educational purposes only. Know that everyone's experience will look and feel differently. Hi, Layla. Thanks for your willingness to be part of this demonstration.
Thanks. Happy to be here.
So before we get started, are there any parts of you that are active or wanting attention right now that you feel to name?
Yes, I have a part right now that feels nervous to be on camera. I also have a part that is distracted by some gardeners that are outside making noise. In case you see my attention being pulled away, it's probably because of that.
Okay, great. Thanks for letting me know. And how does it feel to name those parts right now?
It's helpful to name them. My body feels more relaxed now.
Wonderful. Do you feel comfortable moving into the demonstration?
I do.
Great. So as I go through some of these questions, feel free to close your eyes if it helps you go inwards. As you listen to our group's presentation on IFS therapy, you may have been thinking about some of your own parts, particularly your protector parts. If not, go ahead and feel into your parts now. If you can't think of any, consider your inner critic, or a part that makes you work too hard, or a part of you that takes care of too many people. I invite you to pick one protective part to get to know for a few minutes and just notice that inner voice or emotion. Notice the thought pattern, the sensation, and just focus on it exclusively for some moments. As you're doing that, notice where it seems to be located in or around your body, and take some moments with that. It's totally okay if you don't find the location. In that case, just sense it and focus on it being there. Layla, can you share what's coming up for you?
Yes, I'm noticing a protector part that wants to hide, that doesn't feel safe being seen. I feel it around my heart.
Okay, good. So as you focus on it, notice how you feel towards it. And to our viewers, you're invited to do the same. So how do you feel towards this part? Do you dislike it? Do you want to get rid of it? Maybe you're afraid of it. Do you resent how it dominates? Do you depend on it? Just be curious about the relationship that you have with this part of you. So Layla, what do you notice about your relationship with this part?
I definitely don't like it and wish it wouldn't be here. I know that it keeps me safe, but I feel it makes me small and it's hard to break out of that. I feel like this part overtakes me and runs the show.
Thank you for sharing. I'm going to ask you to keep focusing on this part, our viewers too. And if you feel anything except for openness, curiosity, or willingness to get to know it, that's likely coming from other parts that have just been trying to deal with it. We're going to ask those other parts of you to relax and take a step back just for a few minutes so you can get to know this protector part. See if they're willing to let you open your mind to it. And if they're not, we just won't pursue this, and instead we can explore the fear about them letting you get to know this part. So Layla, where are you with your inner exploration?
I feel like I can focus on the part. It was helpful to tell the other parts to back down.
Great. So focusing on the part, being curious about it without an agenda, ask it what it wants you to know about itself. And resist thinking about the answer. Just wait and see what comes from that place in your body. No need to judge what comes. Whatever comes, just go with it. What does it want you to know about itself? What is it afraid that would happen if it didn't do this role inside of you? Layla, is there something that your part wants you to know about it?
Yes, it's afraid that if it doesn't hide, that I'll be made fun of or put down or not taken seriously. It wants me to know that it feels sad and tired, but scared to rest.
Okay, so there's some fear there. For our viewers, if the answer from your part is related to fear, it's telling you something about how it's been trying to protect you. If that's true, go ahead and extend some appreciation to this part for at least trying to keep you safe, even if it backfires or doesn't work. Let it know that you appreciate that it's trying to protect you and see how it reacts to your appreciation. Now, ask the part, if it didn't need to protect you so much, what might it like to do instead if it were released from this role? Again, if the part was liberated from this protector role, what might it like to do instead inside of you? Layla, what are you finding?
I'm not sure what else it would do. Maybe it would finally rest. Maybe it wouldn't feel so sad anymore.
Okay. Now go ahead and ask it this question. How old does this part think you are? And don't think, just wait and see what comes. Layla?
It thinks I'm 10 years old.
Okay. So if it got your age wrong, go ahead and update it. Tell the part how old you are and see how it reacts. Layla?
I sense the part was surprised that I'm 35 years old. I felt some distance from it. That's interesting.
Yeah, it is. So the last question for the part is, what does it need from you going forward? And just wait for the answer. Layla, is there something coming up for you around what this part needs from you?
Yes, it needs me to know that I'm okay, worthy of being seen, and it's okay not to be perfect. It needs me to embody my wisdom and inner knowing, and it tells me that there's nothing to be afraid of.
Beautiful. So when the time feels right, thank your part and start shifting your focus back into the room. Maybe take some deep breaths as you do that. So ideally, this is the beginning of a new relationship with this part. And like any other relationship, it's ongoing work to explore, understand, and communicate with this part, which is work you can do on your own. So every day as you get up, you can check in with this part of you. Ask it, how's it doing? What does it need from you? What does it want you to know? And ask yourself, are you able to have compassion and appreciation for this part? It really becomes a life practice, and it will reverse if you don't stick with it. Another tip is after the session, there's a lot of value in journaling or writing down key takeaways from this exploration. So Layla, how are you feeling now?
I'm feeling grateful and curious. This was a really interesting exploration. Thank you.
Thank you for your openness and willingness to explore. And thanks to our viewers as well.